Good afternoon and welcome to Facebook Live with Holy Cross Health. My name is Brenton Andrasic, Manager of Physician Alignment and Business Development for Holy Cross Health. Before we begin, I'd like to call your attention to a few ground rules that you'll see in the comments section. We encourage you to participate, but please keep any questions and comments general. We won't be discussing anyone's specific health situation in this public forum. If we can't get to every question today, we'll provide additional feedback through our website, or we can connect with you one-on-one through our various program channels, such as phone or, again, our website. For those of you joining us today on Facebook, we thank you for being here and for taking an active role in your health. And we at Holy Cross are happy to be your partner in your health journey. Today's discussion will provide information about the important role a primary care provider plays in promoting good health and wellness. And you'll learn how you can connect with primary care providers right here at Holy Cross. Today, we're here with Dr. Lial Shao, a family physician, and Dr. Bharti Srivastava, an internist and geriatrician specializing in the care of older adults. Dr. Shao serves as the lead physician at Holy Cross Health Partners in Kensington. He has extensive experience working in primary care practices for more than 11 years. He also has a special interest in using health informatics to improve care for his patients and helping other healthcare providers to optimize their use of technology. Dr. Srivastava joined Holy Cross Health Partners at Asbury Methodist Village in 2020. But with nearly 25 years experience, Dr. Srivastava brings commitment and compassion to the care of older adults. Working collaboratively with patients and caregivers, she provides comprehensive medical management attuned to the changes that occur as we age. So to start off, Dr. Shao, welcome. Can you explain broadly what is the role of a primary care provider?
Sure, Brendan. Well, first, thanks so much for having me here. I really appreciate this chance to interact with our patients or potential future patients here. In terms of primary care and the role of a primary care provider, I like to think of our job as basically being a coach in a sense, right? Where doctors and of course patients come to us when they are sick, when they have questions about their health. But as a primary care physician, I think one of the main points that we try to get across is, hey, what can we do to help not only get you healthier, but keep you healthy, right? So in other words, we want to try to prevent things from happening so you're not having to treat things. It's always better to prevent than to cure from our point of view. So that's one of the goals in primary care and having a PCP is to have somebody who could be there for you, who you can, again, get advice for about any ailments that you might have, but also be there for you when you're not sick, but to help keep you along that right path to stay healthy.
I think there's a lot of ideas there that we can explore further as we go through our time together today. So, Dr. Shao, what are some of the healthcare services that you can expect to get from a primary care provider?
Yeah, so in general, again, as I mentioned before, preventive medicine, preventive care is one of the main facets of what we provide in terms of the services that we give. So I think most people think of when they come in to see their doctors, oftentimes it's for that physical, right? Definitely true when you're a child, but then as an adult, it's true as well that, just as a kid should go in every year to check to make sure that they're growing well, to make sure that they're eating well, to make sure that their labs are normal, they're getting their vaccines. Adults need to have that kind of care as well. And, we often kind of think that we're invincible, right? We made it this far already, we're going to be fine. But that's our job, and the services that we provide is to help kind of make sure that you're right? Make sure that as a patient, you are doing the right things to keep yourself healthy, and then maybe pick up some things that you might have overlooked or didn't even know about. We pride ourselves in keeping up to date with the most recent guidelines for maintaining good health care and screening for things like preventable diseases, cancers, a big one. Everyone's always worried about cancer. A lot of people are just worried and they don't do anything about it. And our job is really there to provide that service of, hey, you know what, there are some things you can do to make yourself not worry as much. We can screen for certain things. So again, that's one thing that we really pride ourselves in providing to our patients.
And Dr. Srivastava, welcome to you as well. Thank you for joining us today. We at the start, I mentioned that you're a geriatrician. Could you tell us a bit more about what exactly that means and what's the difference between a geriatrician and an internist or a family physician?
Sure. First of all, thank you again, Brenton, for having me on this forum. So geriatrician actually is a primary care physician with additional training to treat the older adults, and especially 65 and older. How it is different from internal medicine. The internists are the doctors who can play primary care physician role for adults, 18 and older, in some places 12 years and older. Geriatricians usually see patients 65 and older. So because the older adults have more complex problems and multiple problems, and they're on multiple medication. So geriatrician goes through additional training, 1 or 2 years to get the experience and skills to treat the older adults. So I should tell you one thing, the basic training is either family practice or internal medicine. And then training for geriatrics starts after that for 1 or 2 years. So they have a little bit extra training to have their older adults get better care, health care of what they need, due to their nature of having multiple problems.
Mm-hmm. And what are some of the common conditions that you typically help older adults to manage in your practice?
So the common conditions that we see in a younger adult, like hypertension, diabetes, they continue, right? So we manage that, but quite often we see additional problems like dementia, Alzheimer's, depression, arthritis, osteoporosis, urinary incontinence, frailty. And also geriatrician can help to manage the palliative care and transition towards the end of life care if that's what is needed. So those are the common things that we do as a geriatrician.
And Dr. Shah, I want to turn back to you for a moment. We talked a little bit about this already, but I'd like to expand a little bit on the idea of regular contact with your PCP. Why is it so important to have that regular visits and to have a really good established relationship with the primary care provider?
Yeah, so not only is it important, again, to get those yearly physicals, make sure that you're not missing out on recommendations in terms of lab tests, screening tests, and vaccines, but when you have a primary care provider who really knows your health history, it makes life a lot easier, and it actually keeps you healthier, I would argue, because you'll have somebody who's already familiar with your background. So if I've been seeing a doctor for a few years, they already know about, let's say I had diabetes or I had hypertension, they already know that I've had some difficulties with maybe lifestyle changes because I have a really busy job, I have children, I have cats and dogs I have to take care of, then it makes, I think, that connection a lot easier, and it makes the treatment a lot more efficient, because then you're not going to have to spend a lot of time trying to explain again why you can do this or why you can't do this. And I think when you build that connection, you also have a lot more trust. You have patients who are more willing to open up and kind of let us doctors know if there's something that's really a barrier. It's going to be easier to share that with somebody who you, again, know is your primary person to go to, as opposed to a random physician or provider that you haven't seen before, haven't met before.
Mm-hmm. Yeah, and Dr. Srivastava, picking up on some of those ideas, similar question to you. You mentioned that older patients tend to have multiple chronic conditions. They tend to take more medications on average. How does having a regular relationship with a geriatrician help older patients to be successful in their care?
So given the conditions you mentioned, older adults have more chronic medical condition, more medication, it becomes even more important to have primary care physician who knows you and whom you trust. So the geriatrician or the primary care physician takes care of you when you're sick and takes care of your chronic medical conditions. But I would add this to the geriatric population, that then we also, not necessarily we don't do it by earlier, younger age, but it becomes more important in older adults that what they think they want, what is their goals, what is their value, and then you provide that kind of treatment. You discuss the goal together with the patient or the family or caregiver, and then you determine the goal. So it is actually even more important to have a geriatrician as a primary care physician, or a primary care physician itself, who knows you well, all your medical conditions, who knows all your medications, who knows you're seeing other specialists, what medications are being added on. So together as a whole person, PCP or geriatrician can provide the best care that you would need.
And You mentioned there the idea of taking someone's personal desires into consideration when you're helping to formulate a plan. I wonder if you could just expand a bit upon that idea, how you really take the individual into consideration, the person that's sitting in front of you in your practice, and what they want to get out of their treatment plan when you're thinking about how to work together with somebody to craft a successful treatment plan.
Sure, sure. Very good question. So as a physician, I would know everything about your medical condition and your medications, but we like to take more time to know you as a person, as a whole. We spend more time in gathering the information to know you as a whole. And then we always, as a good physician, like any other good physician, we discuss the goal or make a plan together. But it's good to know the patient and the doctor know each other and trust, so the patient can verbalize their goal, their opinion, their thoughts, their feelings, their values. And then, given the nature of the problem and the patient's desire and wishes, we try to come up together, and not to forget the caregiver there as well. So we come to a plan that is agreeable and safe and medically recommended, so if person is not making a good taking a good judgment, we guide them that, given all the options, and if they ask me, then what do you recommend, then I do recommend, because I know you, I know what your feelings are, your thoughts are, what you say about life and your experiences. It all comes together to make a plan that is best suited to that person. So like example is like you can manage diabetes at any age group, but at some point later in life, when you're 90 years old, to you, it may not matter you poking your finger 4 times a day and you have absolutely perfectly controlled blood sugar. It is probably not important to the person. And if I come to know, then I design or plan the diabetes management according to that. So this is just an example.
Yeah, such an important idea there about the importance of having that relationship with the provider and having somebody that truly knows you and understands you as a person and can work together with you as you try to navigate the healthcare system. To that end, Dr. Shao, an important part of what primary care physicians do is to help patients to navigate what can be a complicated and burdensome healthcare system sometimes. Could you tell us a little bit about how primary care physicians coordinate care and help patients to get where they need to go and make sure that they're being followed up when they're having care that's done outside of primary care?
Certainly, yeah, that's a great question as well. I was just thinking about how Dr. Srivastava, I would say that she probably has a more difficult job with navigating some patients, because nowadays, you have patients who have so many different specialists, and unfortunately, it does tend to be that the older you are, the more healthcare issues you might have, and the more specialists you might have to go see. So I've worked with some of Dr. Srivastava's patients, and I've seen that some of them will have to see a cardiologist and a neurologist and a podiatrist, and also have physical therapy, and so it can be overwhelming for a patient. But for us, fortunately, we already have relationships that we've crafted with a lot of these specialists in the area. We know also what each of these specialists are best at doing, right? Because sometimes you might have a patient who let's say they had urinary issues and they're thinking, I need to go see a kidney specialist. And then we'll tell them, no, actually, you know what? You probably need to see a urologist instead. I would not expect a patient to know that. That's what we go to medical school for, is to help figure that out for them. So in that sense, we serve as a guide to help make sure that the patient's going to the right place for the right care and that they're utilizing services appropriately, so that they're not wasting not only their own time and their efforts, but also wasting money potentially seeing the wrong person. And then you have, of course, after you've seen those specialists as a patient, what do you do with all that information? And also, are the specialists talking to each other? Sometimes they don't. Sometimes you might have one specialist who's doing one thing, another specialist is doing another thing in a similar area, and that could potentially lead to bad outcomes, as you can imagine, if there's any kind of conflict or contradiction. So again, as the primary care provider, our job is to help bridge all of these specialties and make sure that the care that's being given is appropriate and coordinated and communicated appropriately.
And Dr. Shao, we mentioned up top that one of the things that primary care providers do is to help healthy patients to stay healthy. The preventative care is a key aspect of this, especially for younger patients. And so I'm curious, how you work with your patients to help those who maybe don't seem like they have a lot of health issues currently to be able to stay that way as much as possible and to maintain their good health.
Thanks, Brandon. That's a great question. I think the main thing that we try to emphasize is education, right? So this is a partnership with our patients, as Dr. Srivastava pointed out. We're there to be your partner as your doctor and to help educate and answer questions. And in a lot of cases, it means also making sure that you understand not only what might be important to check for or to maintain in good standing for your health, but also why it's important. Because a lot of times we can tell people all we want. You need to do this, you need to do that, but really that's not what we want to do. We want to make sure that when we educate a patient and we give them really an informed essentially consent to do these things, because we want them to know everything that we would know about why that is important. And it's when you do that, that's when you, again, gain patients' trust, but you also then, again, make it more worthwhile for a patient so that they know, oh, okay, this is the reason why this is important. And I think that pays off because, again, down the road, you'll understand, okay, this is the reason why I need to get a colonoscopy starting at age 50, or actually now starting at age 45. And, again, the patient's going to say, well, why is it earlier? And we can then explain, well, there's these studies that have shown that the earlier you screen for these things, the earlier you can catch them and treat them, and you're going to have a better outcome. So again, we can do the heavy lifting for our patients to help figure out why something is due. And in that sense, we also can be the people who can help interpret whatever someone's looking up on Google, right? Because we all know that a lot of us, including doctors, sometimes we Google things, but nothing on the internet is for certain. You got to make sure that you have a reliable source, and we like to serve as that for our patients.
Absolutely. A key theme I think that's coming out here again and again is the importance of that relationship that you build with the provider. Dr. Srivastava, what can patients do to get the most out of that relationship with their primary care physician?
Oh, sure. So assuming that you have a trusted relationship with your provider, so after that, I suggest that the individual to be very honest and communicate well, bring out all the concerns or questions. Again, I will add their thoughts and everything, and the Google search as well, everything that they have in their mind, share with the provider. So when I know what actually you're thinking or actually you're worried about, then I can address that, I can get to that once I get to know. Also, I have suggested many times for individuals to write their questions. When you're at home, something comes to your mind, you jot it down somewhere and keep adding to the list. And when you come to the provider's office, you don't forget to bring the list. If list is very long, then at least have in your mind, decide that I'm going to ask these 2 most important concerns today. So that way you don't say that when you leave the office and you say, oh, I forgot to ask this. And it happens, or during the visit, it happens often that I know I had this question about that medicine with blue pill, but I don't remember now. So that's why I suggest, this is my big thing, that please write down your concerns as and when they come to your mind, write down on a paper, bring it to me, and we'll figure out what needs to be addressed today. So that's how you get the most out of it. I don't say don't go on Google, but when you read something, you share with your physician to figure out what actually applies to you. Not everything applies to everybody. So you can share with me, and people do share with me that, and now we're honest. You say, I will ask, where did you get this information? So if it's Google, that's fine, not a problem. Let's see what applies to you. Then quite often I get this, my friend or neighbor or someone said this, so I need, or should I have this or not? So then I say, okay, let's sit down, let's see what's your problem, what your friend said, and what applies to you. So we will do that, or if it doesn't apply to you. So as Dr. Shah was saying, we're a guide and we're a coach, for your health journey. So that those, especially the list, is very helpful when you see a geriatrician, given that age group, because just simply the fact there are number of medications, number of conditions individuals have. So it's good to write it down. So that way you get the most out of it. Just remember that each provider, we do spend a lot of time with the patient, but it's still there's a schedule to go. So if you really want to make value of your time with one-on-one with provider, you know what you have to ask, the 2-3 things that you must ask today or must address today. So that way we use the time very efficiently.
Yeah, I think that's a really important point. And speaking of the idea of coming with specific questions, we did get a question from our Facebook Live audience. So Dr. Srivastava, I'll address this to you, but Dr. Shao, feel free to chime in. Someone asked how they can attain good digestive health. A general question, I realize, but what sort of tips might you have for someone who's looking to maintain a happy gut, as it was phrased?
Happy gut, yes. So the gut is part of our body which needs regularity, right? That's what we need. So for that, eating healthy, that's where we start. So the fibers are very important, so you have enough amount of fibers with fresh fruits, vegetables, etc. So that will have regularity. Rest of the diet should be healthy diet, healthy balance, not just a lot of carbohydrate or just a lot of protein, but a balance will guide you through and maintain the regularity. But this is very general because we're not talking about any symptoms, right? So also I think nowadays taking probiotic, especially when you're on antibiotic, that might help to maintain the normal gut flora, okay? Beyond that, I will see if Dr. Shao has any suggestion.
Yeah, sure. I'm not surprised that this was a question, because this is probably the most common complaint or question I get in primary care, is that, someone will come in and it'll always come up last, right? It'll be as we're about to finish the visit. And it's because, for some people, it's a little embarrassing sometimes, and,
Yes.
I've gotten people who tell me, like, as I get older, I just get more bloated or I get constipated, and nobody likes to talk about that. But hey, that's what we're there for. And the best part is everyone always apologizes. Like, I'm so sorry, I just told you this. And I'm like, no, you know what? That's fine. We're doctors. That's what, again, we went to medical school for. If we can't handle this, what can we do? One thing I agree completely with what Dr. Srivastava has suggested. It's so important that maintaining a healthy, balanced diet it's harder to do than it seems, right? A lot of us will say, oh yeah, I can do that. But then you think about it, wow, every meal, you've got to really make sure that you've got a good mixture of greens and fruits and vegetables. And you can also have your protein and carbohydrates, but you, again, have to keep that all in balance. The other thing I like to emphasize is actually exercise. I think, it's sometimes underrated how important exercise is for your gut, because a lot of folks, especially who have constipation, they maybe don't exercise on a regular basis, or they think they're exercising. Oh, well, I walk a lot for my work. Well, that's not quite the same thing. So, what I've found is that if you encourage people, go for a walk, for recreation, go for a jog, go for a swim, go for a bike ride. What that does is it helps with gastric motility. It helps to actually move the gut and the intestines along, helps keep things more regular, right? So that helps to prevent constipation, which then helps prevent bloating. So a lot of this is all interconnected, and diet is important, so is activity level. But I think if you kind of start with those two basic aspects to gut health, it's already a lot, actually, to try to manage those two things. A lot of people, again, underestimate how much they actually need to do in order to maintain that kind of good balance in their life.
Well, I think that everyone watching just got a good sense of why it's so important to have a good primary care provider who can answer questions like that and to give you a good source of information. Dr. Shao, in that vein, we've talked a lot about some of the benefits of having a primary care provider. Let's say someone out there is thinking, you know what, this sounds like something that could benefit me. I don't currently have a primary care. What would you suggest that person should look for when they're looking for a person to establish a relationship with?
Yeah, so it's a very important question. I think a lot of times it starts with just getting to know your provider, and that can start with just taking a look at their profiles. And what we're doing is we actually, on our website for Holy Cross Health Partners, we have profiles for all the providers. You can take a look at some of our backgrounds, some of our practice philosophies. It's also important, a lot of people, they focus on, oh, where did he go to medical school, or where did he go to residency? You know what I found in my years, it really doesn't make as much of a difference. What you really want to have is somebody who you feel like you can have a connection with, who you feel like communicates well. In fact, I would say that's probably the key aspect of care, is that you got to have someone who you feel, if you had a problem and you call their office or you message them, that they would get back to you in a timely manner. It's something that I haven't actually consistently had in my life in terms of my medical care. So I can appreciate how important that is. One thing that we strive for at our practice is communication and making sure that we stay connected with our patients. Not only do we, of course, take phone calls, but we actually have this patient portal, which I'm going to plug right now. It's through this program called MyChart. We use Trinity Health's electronic health record, and it comes with this really great software that I've actually been using for the last 11 years at my other practices as well. And it allows patients to directly message their providers, ask them any questions that they have. When Dr. Srivastava pointed out, you might have forgotten to ask a few questions, you left your list at home. That could be a way for you to continue that conversation. Or at least, you can tell us in advance. I had one patient who just messaged me and quote unquote warned me in advance about all the questions he would have. He said, I have a couple of questions. And of course, for him, a couple is 5. That was great, though. I was really appreciative of that, because then when I see him in a week or two, I'm not gonna think, oh, well, I'm gonna focus on whatever it is I want to talk about. I'm gonna know what it is that is important to him, because we need to address that first. And so again, having that communication is key. And I think if you can find a provider who can do that, that would be the first step. And I do want to say that we provide that kind of level of communication at our clinics.
Yeah, and it might be a good opportunity to mention the Holy Cross Health Partners does have 3 primary care locations currently. One is at Asbury Methodist Village, one is in Kensington, and then also Progressive Medical Care in Montgomery Village. Dr. Shao, could you just give us a quick rundown of the types of care that are provided in each of those locations, and what services are available for patients?
Sure. If I may, I'll start with Dr. Srivastava's home base, which is Asbury Methodist Village, located in Gaithersburg. It's a clinic that's actually located on the campus of Asbury Methodist Village, which is a retirement community. And as Dr. Srivastava pointed out, she's a geriatrician. She sees patients mostly above 60 years of age, but she is able to see patients who are 50 and above. She has her other provider there, Dr. Wilkerson, who is also a geriatrician, also sees the same age patients. So they both together provide care for our patients in that community. And it's great because, again, you have patients who are living in the independent residential portion of the community, but sometimes as things progress, unfortunately, some patients receive and need a higher level of care, and they're able to follow them through for that as well. So that's our clinic in Asbury Methodist Village. Progressive Medical is actually our newest partnership. They joined Holy Cross Health Partners back in March. Actually went live with the same electronic health record just a couple of months ago. And so now we're basically fully integrated. And we have 2 excellent providers there, Dr. Tassim Naqvi and Dr. Lillian Mukuro. I'm sorry, nurse practitioner Lillian Mukuro. And they actually see patients 5 and above. So they're our only site currently that sees pediatric patients 5 and above. But they're both family medicine practitioners. And again, they're both excellent. They've been actually providing care there for close to a decade. I need to maybe double check the number of years there, but they've been around for a while. They're actually very well known in that community. And it's in Montgomery Village, which is essentially Gaithersburg as well. So they're actually very close to Asbury Methodist Village. But as you can tell, it serves very different patient populations, in that Progressive tends to skew towards the younger population. And then finally, we have Holy Cross Health Partners at Kensington, which is my home base. There we actually have 4 providers in total, including myself. We also have Dr. Dushin Farr, Dr. Elham Gayuri, and we also have a nurse practitioner, Tigis Tilahun. And there we provide care for patients who are 18 and above. So even though I'm a family medicine doctor, the other providers there are internal medicine trained, and we focus primarily on adult patients. We're not currently seeing pediatric patients at this time. That being said, again, we see patients of all adult ages, I should say. So even though right now my patients tend to skew more towards the younger side, and by younger, I mean maybe 30s and 40s, but we also have our share of geriatric patients who are in the 60s and 70s, and we have a few that are in their 90s, one that's over 100. So it's quite a diverse population.
And how could someone who's interested in making an appointment with any of the providers that you just mentioned go about doing so?
Yeah, so again, you can either call our clinic, but what I really want to plug is, again, our website. So even if you don't have a MyChart account, you can actually go to our websites, either for the Kensington practice or Asbury Methodist Village or for Progressive, and you can actually schedule an appointment directly there as a new patient. You can see our schedules. It's actually pretty open for the most part. So you can actually get in usually to be seen within a couple of days with a provider of your choice. Again, we also have the provider profile, so you can take a look and see what our practice philosophies are and make sure that it's aligned with what your goals are for your healthcare.
And we're coming up on the end of our time together, but I just want to ask Dr. Srivastava and Dr. Shao, feel free to chime in as well. What makes the Holy Cross Health Partners primary care group special? What are some of the things that patients can really benefit from being a part of the Holy Cross network?
Good question. So it's a lot of benefits to be a patient at Holy Cross Network. First of all, we all know about Silver Spring Holy Cross Hospital, which is very established and well known in this area. And they have another hospital in Germantown, which is 7 years old, to serve this side of population. So if you're very sick or you need to be in the hospital, you need a procedure, a bigger test, or surgery, then that care is there. And the outpatient doctors that we are just talking about, Dr. Shao mentioned all of the doctors, we use the same electronic medical record as the hospital. So we have a way of continuity to see what's going on in the hospital, or when they are seeing some of the specialists, or if Dr. Shao happened to see one of my patients on an urgent basis, I have access to the record and I completely see what he decided, what he did, what he offered to the patient. So the continuity is a very big thing, to have the records in the same place, and the doctors, outpatient doctor or inpatient doctor, are able to see each other's. So the hospital doctor can also see my documents on a certain patient if they want to know. Not only that, we have communication with inpatient doctors by electronic method or by a call. You know, sometimes it happens rarely, but I needed to call and say what happened or what's going on. They can call us to say, what did you do about this, if it's not clear from the document. So there's a good communication through the hospital. As far as the outpatient management is concerned, we have very good support from Holy Cross, especially all these 3 clinics that we just mentioned. We have support of pharmacists, which is very rare. We're just fortunate to have a pharmacist working with us along our side. So she provides us a consultation. If I have a question, I go to her about a medication, something in-depth question. So she provides me with her consultation, but our patient can see her as well. If they have questions about medication, side effects, or some symptoms, some question that, let's say, dizziness. You know, so quite often I get asked that, am I dizzy because of these are my 15 medications? And I am very fortunate to consult the pharmacist. Either I talk to her or directly the patient can communicate. She goes into detail of each medication, the interaction and possibility of the question being asked. So that is a great advantage that I have. We all have, Dr. Shao and the other clinic. Another support we have from Holy Cross is that we have a care manager, 2 of them. So one of the nurse manager helps us when patient transition from hospital to a nursing home to home or rehab. So she follows them and makes sure that hospital instructions have been followed and patient is able to do that. If not, she helps them to navigate. So this is navigating from inpatient to outpatient. She also helps us with if a person has several issues and having challenge managing through the specialist or getting to the specialist, she navigates, she directly helps the patient to help to get those things done. And then we have another nurse manager who helps up to several months until they settle down with whatever active medical care is going on and needing help. So in these regards, I think I feel very fortunate that Holy Cross is supporting us with these facilities to us and to our patients. So that's why I think it's really good care and good support that we have.
Well, we're about out of time. Sorry, Dr. Shao, go ahead.
Oh no, she has done a wonderful job, Dr. Srivastava. I don't really have much to add. Yeah, it's like she said, we have a lot of resources that Holy Cross has shared with us. There's also community health workers who can help patients who have social needs. We're actually screening for social needs now. So if patients are having issues with food, if they're having issues with housing, we can actually help and direct those patients to the resources in the community. And again, we have assistance from Holy Cross community health workers to do that. You know, besides that, I just want to plug, this isn't from Holy Cross, but we actually have on-site labs. So we have Quest labs for both Kensington and also Asbury Methodist Village, and for Progressive, we have LabCorp to recognize names. And I think for a patient, that could be a huge deal. I can't imagine now being at a location where I'm seeing my doctor, and then to get labs, I have to go somewhere else. You know, a lot of times you just end up not doing the labs. Especially if you came in fasting and you're super hungry, right? So, so we pride ourselves, I think, in providing those services on site for our patients.
Well, thank you both so much, Dr. Shao, Dr. Srivastava. Lots of great information, lots of great insights. And thank you, everyone who's watching on Facebook or anywhere else. We appreciate you tuning in today. If we didn't get to your questions, we will provide additional information through the Holy Cross Health blog, or we can connect with you over the phone or via our website. You can connect with us to learn more about our Holy Cross Health Partners primary care at holycrosshealth.org/HCHP. So thank you again for joining us today on Facebook Live with Holy Cross Health, and we hope to see you all again soon.
Thank you and stay well.
Take care.